Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about medical coders audits. Now, I've gotten a few emails this past weekend about medical coding audits. What is it all about and who does the auditing and how do they know what is correct? Okay, so every facility is different. Sometimes they have one person that works with data quality, and that will be your auditor, somebody from there, and they will pull these records. And sometimes it's your supervisor. It just all depends. In my instance, and I will share my instance with you guys and how things work for me at my facility where I work. So where I work, my supervisor does the audits, and she will take a report of all of the encounters that I have coded in an entire month. And she will randomly pull, let's just say, for example, 10, okay? Just to give you guys a good round number to work with. So she'll pull 10 records at random, and she'll say, okay, I'm going to look at these 10 records, and I'm going to see if the codes that Blue selected versus what the provider documented, if they marry up, okay? And if there's anything missing, she can write it down and then let me know, hey, you missed this diagnosis, or you missed this procedure, or what were you doing? What did you think about for this evaluation and management level? How did you get to this level? So she will look at everything that I coded, and she will look at what she would have coded, and she'll say, okay, either they marry up or they don't, So if they don't, and we have a disagreement on how a code was selected, let's just say, for example, I selected a particular code and she selected another one. And she'll say, okay, Blue, I got this code. How did you get your code? And if I can explain to her how did I select it, then, she can either agree or disagree. If we can't agree, if I have a good argument and she has a good argument for whatever it is, the diagnosis, the level, or the procedure, and we just cannot agree, then we bring in a third party neutral person to sort of break the tie and see, who would be correct, especially if we both have good arguments. And audits are good because they're a learning tool. Sometimes I will learn things, or sometimes my supervisor will learn, from me, what, certain things are or whatever. Because everybody that audits has the opportunity to learn a lot more, because they see what somebody else would see versus what they would have thought of, This is why it's very important to be as open to correction as possible, because there are some people that get upset when they get audited because they see it as a personal attack. If the supervisor finds something that was wrong, or the data quality person finds something wrong, I don't see it as a personal attack because I know that with my supervisor, she understands the amount of work that I do to get these providers to document appropriately so that I can pick up everything appropriately. But there are some times when I miss something, and it does happen. Sometimes I just happen to miss a code, or I didn't pick up something that should have been picked up, and she'll catch it and she'll be like, well, what about this? And I'm like, oh, I missed that one, So it's a good opportunity to learn, and it's a good opportunity to make sure that I am doing everything appropriately. Sometimes, there's just things that you're going to learn along the way when it comes to medical coding, and you'll learn them from whoever your auditor is. And my boss has told me before, the thing I like about you, Blue, is that if I catch you on something, you never make the same mistake again. And that's the goal, is to not continue to make the same mistakes over and over again. This means that you can learn, when you've been given direction. I do not like to be marked incorrect on anything. I hate it, especially when I know that I try really hard to make sure that I get everything right, And so, but sometimes, like I said, it does happen, but we've had instances, my boss and I, where I have not picked up a procedure because it was not documented. And she would say, well, they selected it. I said, I understand, but it's not documented. And so she was like, well, no, they have this and they have this and they have this. And I said, it's not complete because it needs this and it needs this. And I showed her where in the description. She was like, oh, okay. Well, I can see how you would get that. So that was an opportunity for me to educate my provider. Well, this is missing and this is missing. Did you do this? And as it turns out, they weren't. So fortunately, no one lost any credit for something that they didn't do anyway. So that was a very good catch on my part. And that was just something that I had to learn because this was starting in the pulmonary clinic when this happened. And so I insisted because I said it's not there. And I pulled from all of these different resources like that were online. And I was showing her how that came up. How did I not get that procedure? And it's deceptive when you're looking at something and it looks like something, but it's actually not it. It just has to get when you're coding procedures. You really have to make sure that everything is there. And the best way to know what that particular clinic is doing is to ask the people that are in the clinic that are performing those procedures, what are you doing? Can you talk to me about what it is that you're doing? Because sometimes you'll find this, certain procedures are really similar to each other, and sometimes they can overlap if you don't watch out. So you don't want them to overlap. You want to be able to either select one or the other and make sure that you're selecting the appropriate one. So this is why it's so important to do your research on your own, because it's going to make you sharper, especially when you go for your audits and they're asking you, hey, this was selected, why didn't you pick it up? Because in my facility, the provider will select the diagnosis and the procedure, but they don't always select the correct one because sometimes they don't know, and they aren't medical coders. And that's what I say all the time too, is I don't expect my providers to know how to code. That's my job. That's why I have a job. I don't expect them to know how to code. What I expect them to do is to document appropriately. What I expect them to let me know is, what are they doing? If they are doing something that they don't know what the code would be for, they need to come and talk to me. That's what I always make sure that they do. Okay. So, because sometimes you will have that. You'll have where a provider will say, well, I'm doing this new thing in the clinic. Okay, good. So what are you doing? Tell me exactly what you're doing so that way I can see is there a code for it, It's all about that good communication. But getting back to those audits. So if it's not documented, then you can't pick it up. But if they're missing something, then they need to know, right? Like, what are they missing? Why did they not do this? Why did they not get this code? If they selected it and they didn't get it, I need to be able to explain to them, why didn't I pick this code up? So that's that all goes part of it, with the whole thing. So she will look at the provider's documentation as well and tell me, well, I don't think that they're documenting this, but they're not documenting it as well as they could be, And so that's when I'll have to go and I'll talk to them again. But she knows that I'm very notorious for my communication with them. She knows that it's very important to me. So I won't take it personally if she's telling me, hey, I need you to talk to them about this, or I need you to talk to them about making sure that if they're doing this, that they document it as well. We can't tell them how to document, but we can just tell them, hey, if you are doing, what are you doing? Everything that you're doing needs to be documented. If you are running a lab, what are you running the lab for? If you are addressing another condition, what are you addressing? It's not, one provider told me, it's just common sense. Sir, I can't, if it's not documented, I can't just assume, Well, wouldn't you assume if the patient was post-op that they would be getting all it? I can't assume. All I can do is just code what you have there. Oh, this is ridiculous. I understand, but I mean, and then after a while he understood, that it wasn't just me, and this wasn't me just picking on him, um he actually had to do more documentation. So, but yes, audits are a good learning tool, okay? Especially if your auditor is willing to teach you how to pick up more things, or what is it that you didn't, what did you miss, I had another auditor that I actually trained her, and I know that sounds a little weird, but I actually trained her because it was in inpatient professional service rounds, and she had never done that before. So when she pulled the records for review, she was like, well, I don't really understand this, Blue. Can you explain it to me? So I explained to her the rules, because when you code for inpatient professional service rounds, the rules are a little bit different, because it's like inpatient, but it's outpatient. So, I had to explain those rules to her. So it was a little hard for her in the beginning to understand, but after a while, she got it, because good teacher. And but I didn't mind helping her, even though for her it may have been a little awkward, because she was a supervisor at the time, and it's like, oh, okay. But and if she could learn it too on her own, that would help her, and so she just worked with me as much as I taught her, and then she was able to carry on with the audits and work them that way. So it was a learning experience for both of us. But needless to say, she audits on her own now, and yeah. But if you are marked as wrong on something, don't take it personally. That is I can't stress that enough. Okay, don't take it personally. The auditor is not trying to beat you up, or at least I hope not. But they're not trying to beat you up, because a lot of times auditors are just people who are very experienced, and they know a lot, and if they have an opportunity to learn something from you, then that's a good thing as well. Sometimes they may not admit it, but it's a good working relationship if you can talk with your auditor and talk frankly, with your auditor. It does help. And my boss, because I always come in there whenever she says, well, there's a supposed error here, and I will get all of my things that she says that I got incorrect or whatever, and I will bring my resources with me when I meet with her again, to talk about the audits. And she'll say, I like that you bring your resources. And I say, I have to. And I tell her, because she's very good, and I need to make sure that I back myself up. And she goes, ah. But it's true though. She is very good, but sometimes, like I said, there's just a disagreement. If there's a disagreement, we try to bring in a neutral third party to settle that disagreement. So it is all about learning. And but like I said, don't take it personally if they mark you wrong. See it as an opportunity to grow and to learn. But if you are right, make sure that you have everything with you in order to show that you're right. Don't just say, I feel that this is right. No, it's not about feelings, okay? This is not that in the feelings challenge, okay? It is all about what you can prove. This is why I say I should have been an attorney. You cannot just go in there, passionately argue, and say, well, I feel it's this way, this way, this way. No. What did you use to come up with this level or this code or this procedure? How did you get there, And if your description, of the procedure, or if your points match up for your evaluation and management level, however you got it, or anatomy wise, did you select the correct code? Bring all of that with you when you are going for an audit, But these audits are really gauged on like, how did the auditor see it, versus how you coded it. Obviously, if you're doing it completely not correct, like maybe you're new and you've never coded that clinic before, and let's just say, for example, you're coding for injuries and you just happen to code, aftercare instead of coding for an injury, your auditor can tell you, hey, it's injuries you're supposed to pick up during this time, not aftercare, and so that's a good time to learn, so like I said, never take it personally, because this is a fact of life when it comes to being a medical coder. It's just one of those things. And if you happen to get an audit that's really bad, it's okay. It happens to the best of us. If you get an audit that's bad, just take it as a learning opportunity and just move forward, okay? Learn to be more, whatever they marked you wrong on, make sure you take some extra time to study on that. Or is it an issue with the provider? Are you covering your tracks? Everything that you're querying your provider on, if they're not documenting appropriately, and you're querying them, make sure you keep those with you. Use read receipts, okay? That's very important. I use some read receipts on providers that are notorious for sort of just deleting emails. I will make sure that I put a read receipt on there. And because of that, they've sort of, okay, now I know she's not messing around. I have to make sure that I read this, because it will happen, especially if you have somebody that's new and they're not used to you, But like I said, it's all about that good communication, and you got to make sure that you're talking, okay? If you don't understand something and the auditor got you on it, and you just are confused, ask the auditor questions too. You have that right to ask them, how did you come up with your argument? And most times they will show you how they came up with it, because every auditor I've known has been able to do that. It's not just I say, of course I have heard horror stories, okay, so I know that it does happen, but most times, if you ask them, they will tell you, hey, well, I got it because of this, Again, always go in there prepared. And like I said, don't get offended, okay, if they're telling you that you're wrong. Just take it as an opportunity to learn, because you can always pick yourself up the next month and have a better audit the following month, So it's all about following the rules and making sure that you have your arguments prepared. Are you prepared when you go before the auditor? Okay. As far as like what happens if you continue to get things wrong, most times if you are continuing to get things wrong, that is a red flag for your auditor or for your supervisor to say, okay, what's going on? Because if you're not getting it, something either needs to be done, or you need remedial teaching or something. And that's okay. If something doesn't click right away, it's all right. Just keep trying. But don't keep doing the same thing trying to get a different result, okay? If somebody's explaining something to you and you don't get it, try to go to somebody else and say, okay, I come up with this, and this book says this. Can you explain it to me? Because I don't understand. It's okay to say that you don't understand. The ones that you should worry about that says, I know everything, that's when you're wrong. If you see somebody that says, I know everything, chances are they don't. You can't even fake that until you make it, okay? Because I'm a decade plus in, and I'm still learning something every day. So just keep that in mind. But don't go to somebody else because you don't like that other person's answer. Go to somebody else only if you don't understand how they're explaining it. Because when it comes to teaching and people learning, especially adults, okay? Children is one thing, but with adult learning, okay, If something is not explained in a particular way that a person can understand it, because everybody learns differently. There's auditory learning, visual, and written. Some people are just, they can learn just by reading. It all depends on what works best for you. If you know that you're a visual person, ask somebody to say, hey, can you show me what this is? Can you show me what you mean here? And a lot of times providers are open to those kind of questions. I have actually gone to Dr. X and asked him, can you look? I said, I looked up this on the internet. I looked up this on YouTube. I read this in this book, and this does not make sense to me. Can you explain it? And so he says, sure, and he'll explain it and he'll break it down, and he talks very passionately about these things. And so he gets it, he gets and he understands how to explain it. So then when he explained it, it's like, light bulb, okay, now I get it. So what he taught me, I was able to take it back to my boss and explain it to her. And she's like, well, that makes sense. So see, we both learned something. But yes, it is just a fact of life when you are a medical coder. But yes, always be prepared with your arguments when it comes to how you got your codes. Be able to defend yourself. And accept it when you see that you are wrong, okay? If you can see your supervisor or your auditor's argument and you know that they're right, don't sit there and keep saying, oh, yes, I'm right. No. If you know you're wrong, accept it, okay? That's all a part of being a medical coder too, because not everybody's going to get it right 100% of the time. Not even me. So, but yes, I hope that has answered some questions, because I'm getting kind of long-winded, and I try to keep these videos about 20-25 minutes, because anything longer than that I think is just too long. But anyway, but yes, hopefully that's made a little bit more sense. If not, just email me and let me know, and I will do another one. All right. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. All right. Well, I will see y'all in the next video. Bye.